BRONCHOMIT. MIT formulation for acute or chronic cough or bronchitis. Bronchitis is inflammation of the bronchi, large and medium-sized airways in the lungs that causes coughing. Bronchitis usually begins as an infection in the nose, ears, throat, or sinuses. The infection then makes its way down to the bronchi. Symptoms include coughing up sputum, wheezing, shortness of breath, and chest pain. Bronchitis can be acute or chronic. Acute bronchitis usually has a cough that lasts around 3 weeks, and is also known as a chest cold. In more than 90% of cases the cause is a viral infection. These viruses may be spread through the air when people cough or by direct contact. A small number of cases are caused by a bacterial infection such as Mycoplasma pneumoniae or Bordetella pertussis. Risk factors include exposure to tobacco smoke, dust, and other air pollution. Chronic bronchitis is defined as a productive cough, one that produces sputum that lasts for 3 months or more per year for at least 2 years. Many people with chronic bronchitis also have chronic obstructive pulmonary disease or COPD. Tobacco smoking is the most common cause, with a number of other factors such as air pollution and genetics playing a smaller role. Acute bronchitis is the most common type of bronchitis. Acute bronchitis, also known as a chest cold, is short-term inflammation of the bronchi of the lungs. The most common symptom is a cough, that may or may not produce sputum. Other symptoms may include coughing up mucus, wheezing, shortness of breath, fever, and chest discomfort. Fever when present is mild. The infection may last from a few to 10 days. The cough may persist for several weeks afterwards, with the total duration of symptoms usually around 3 weeks. Symptoms may last for up to 6 weeks. Acute bronchitis is normally caused by a viral infection. Typically, these infections are rhinovirus, adenovirus, parainfluenza, or influenza. Most cases of chronic bronchitis are caused by tobacco smoking. Chronic bronchitis in young adults who smoke is associated with a greater chance of developing COPD. There is an association between smoking cannabis and chronic bronchitis. In addition, chronic inhalation of air pollution, or irritating fumes or dust from hazardous exposures in occupations such as coal mining, grain handling, textile manufacturing, livestock farming, and metal molding may also be a risk factor for the development of chronic bronchitis. Homeopathy offers a lot of drugs for the management of bronchitis and cough. BRONCHOMIT is a specific MIT formulation for this condition prepared by combining homeopathy drugs in 30C potency. PERTUMIT, ASAMIT and BRIOMIT also will be helpful if the condition is associated with as per indications. MIT formulations are available to registered medical practitioners only. For more details, visit www.homeopathymit.com.